When should you get treatment for a concussion? So first off, if I look tired, I have a toddler. That's just how it is, ebbs and flows. You should get treated for a concussion. Ideally, you should get an assessment within the first 24 to 48 hours. And the reason being is that we're looking for red flags for something more severe than a concussion or different than a concussion that could be permanent or life-threatening. And that's because a concussion is a functional and transient form of traumatic brain injury. It's functional. We're not going to see anything on CT or MRI. It's transient, it's temporary, it's going to go away. We just want to rule out anything bad, more severe, or different in that first 24 to 48 hours. Ideally, at that point, you're also kicking off some initial rehab. Let's say you don't get that initial rehab. When should you seek treatment? If you are still having symptoms at day 10, this is consensus data, if you're still having symptoms at day 10 after your injury, seek some treatment. There's going to be some sort of autonomic or exercise intolerance. There's going to be some visual vestibular dysfunction, some cervical spine dysfunction, some metabolic hormonal dysregulation, maybe some psychological overlap. It might be one of those, it might be all of those, but those are the 5 things we need to check after your concussion, after day 10, to get you back into a normal trajectory of recovery. Which, by the way, a normal trajectory of recovery is 21 to 30 days. That is as fast, if not faster, than an ankle sprain, but we're talking about your brain, not your ankle. Do it right the first time. When should you get treated? Ideally, get assessed in the first 24 to 48 hours and start some active rehab, but at the very latest, try to get in by day 10. Hope this was helpful.